Hello, my name is Sarah Russell and I'm a clinical exercise specialist and clinical Pilates teacher. In this video, I want to show you some exercises and techniques that you can use to recover from your surgery and also to help you prepare for your surgery. So we're really going to focus on the core, the pelvic floor and diaphragmatic breathing. These are things you can actually do straight away in bed within sort of 24 hours of surgery. But it's also really beneficial if you can practice them before your operation so you know how it feels and you've got that opportunity to kind of create those neuromuscular pathways and you really understand the techniques and exercises. So the first thing to do is to make sure that we're coming down onto the bed or the floor in the correct way to really respect and protect the abdominals and the pelvic floor. So we're going to come down onto our back, but we're going to do it in a sideways fashion. So whether you're on the bed or on the floor, we come down onto our side hip. Make sure you've got something to put your head onto. You're going to come down sideways, bring your head down to the floor or the bed, and then just pause and then roll yourself over onto your back. And it can be good practice to just go through that before your surgery, just so you kind of tune in that as a little technique. So we're going to lay flat with our knees bent and our feet flat on the floor. This is called our neutral or crook lying position. So I've got my head on a little cushion. You might find that that's too much and you just want to be flat, and that's also fine. So we're just going to start by thinking about our breath. So I want you to close your eyes and just place your hands on the front of your rib cage. And we're just going to take some nice breaths in through the nose and out through the mouth. I just want you to notice where your breath is going. And out. So just really relax the shoulders. It's very tempting when we're feeling tense and when we're feeling anxious and also in pain. If we've just had surgery, we want to breathe into our shoulders and our necks. It's really important we actually send the breath into our ribs. So let's start to now think about consciously bringing the breath into our ribs as a little breathing exercise. So to imagine your ribs are like an umbrella, and we're going to open the umbrella and then close it. So as we breathe in through our nose, the rib cage comes wide. You should feel it expand into your hands. And then exhale through your mouth and feel the ribs come back down. And again. Exhale through the mouth. Let's visualize that umbrella opening up and closing. This diaphragmatic breath is super important to help us understand the way in which our deep core is functioning. So the diaphragm, the pelvic floor, and the deep core muscles are all connected as a unit. And we start off with this diaphragmatic breathing to get everything connected and working correctly. So you can do this sitting up, you can do it standing, or you can do it lying down. The most important thing is you feel expansion of the ribs come sideways and back. So this time we're going to make that exhale a little bit longer, and we're going to bring awareness now to our deep core. So this is called finding the core and learning how to contract the deep abdominals. We're using the breath, but also with a little bit of conscious thought. So completely relax again. So we breathe in through the nose. We breathe out through the mouth and fully exhale. Really empty your lungs completely all the way out. Feel the ribs come down, and you should feel a little bit of a tensioning of the abdominals. So let's do that again. Breathing in and breathing out. Fully exhale all the way out. Empty your lungs and see if you can feel a little bit of awareness through the front of the abdominals. So as you are breathing out and the diaphragm lifts, the pelvic floor lifts, and the ribs come back down, you should feel this deep abdominal wall at the front just create a little bit of a contraction, almost like you're deflating a balloon. So what we don't want is for you to inhale and then exhale and then send the breath into your belly. So you're kind of like pushing the air and creating a bulge. I want you to try and deflate your internal balloon and to, as you breathe out, just kind of like get this lovely connection. So flatten the belly and let that whole breath be spread around. So let's try that again. So we inhale into the ribs, we exhale, we pull the ribs down, we keep exhaling all the way out and flatten this tummy and deflate that balloon. You get a bit of tension here. Now let's take it one step further. I want you to see if you can actually feel this deep abdominal muscle, the transverse abdominis, actually just switch on under your fingers. You're going to find your bony hip points at the front. You're going to just come into your abdomen and you're just going to place your pads of your fingers just inside your hips, just on your tummy. So your elbows can rest on the floor. And we're just going to take that breath in again. Breathing out through the mouth. Fully exhale, fully exhale, fully exhale. Just see if you can feel a little bit of tension under your fingers. You want to actually feel the muscle firming. And if you're not, don't worry too much, because this is a neuromuscular technique. This isn't about pure strength. This is about your ability for your brain to connect with this deep muscle. So you can see why this is so important, because when we've had surgery, we get a disconnect of this muscle. So learning to do this before surgery is great if you have the chance. And if you don't have the chance and you're first coming to this after surgery, it doesn't matter. Just do what you can. But what the good news is this is by using the breath and your mind, you can start to connect with this muscle. So let's try that again. So I want you to imagine your hip bones are two magnets and they pull together right at the end of your exhale. So let's try that again. We take a breath in. We breathe out. Ribs come down. Flatten the belly and pull those hips together. Keep breathing out. And you're going to feel a little bit of tensioning through the front here, the transverse abdominis, bit of connection. And then relax. Now let's bring a little bit of awareness now to the pelvic floor. So if we've got our diaphragm at the base of our ribs, we've got our pelvic floor at the base of our pelvis. And as we breathe out, the pelvic floor is going to lift inside. So now I want you to imagine that pelvic floor lifting up inside and closing as we breathe out. It's often the opposite way sometimes people have been taught, and the opposite way that feels right, but it seems a little counterintuitive, but this is the way we need to do it. We need to exhale and contract. So right at the end of our exhale, we're now taking all the way down the body, and I want you to think about closing the openings of the pelvic floor, imagining you're stopping yourself, breaking wind, or needing to have a wee. So we're going to try and connect to that pelvic floor as well. So fingertips on your belly, just to see what happens to the muscle. Breathe into the ribs. Breathing out, ribs come down. Hip bones pull together, belly flattens, pelvic floor draws up. Imagine you are trying to stop yourself breaking wind, trying to stop yourself needing a wee. Draw that pelvic floor, hold. Can you feel the muscle at the front? And then relax and let it go. You don't need to hold your breath all the way through. The breath encourages the connection of the muscle. And then once you've got the contraction, you can start to just breathe normally. So let's try that again. Breathing into the ribs. Breathing out, ribs come down. Pelvic bones pull together. Pelvic floor draws up. Feel that connection. And then try and hold the contraction. And now just do a couple of normal, very shallow little breaths, nothing too deep. Just feel that you can breathe and contract together. And that's a little bit trickier. And then relax and let it go completely. So what we're doing there is getting connection of the diaphragm, the deep core and the pelvic floor in a really progressive way. Don't worry if it's feeling a bit tricky. It's just, it will come with practice. So we're going to now move to a pelvic tilt exercise. So bring your hands into a diamond shape like this. You're going to put your fingertips together and your thumbs together and place on your lower abdomen. I'm going to think about creating a little tilt with the pelvis now. So we don't want to push through the legs. We don't want to press the back into the floor. We want to initiate it with these deep abdominals. So place the hands on the tummy. Imagine you've got a little ball inside this diamond, and we're going to roll the ball between the fingertips and the thumbs. So we take a nice breath in. And then as we breathe out, we roll our ball towards our thumbs and we get a little tilt of the pelvis. And release. And inhale to prepare. Exhale. So the ribs are coming down to meet the pelvis and we're getting this little tuck up and release. And again, inhale, exhale and tuck. And again, inhale. Exhale, roll the ball towards your thumbs. Your back will naturally want to flatten into the floor, but that's not the cue. I don't need to push the back into the floor. The exhale is super important because it encourages the pelvic floor to connect and it lifts the diaphragm and we get connection through the abdominals. We'll do one more. And then release, relax, and let everything go. So you could start off with just doing, if you're just post-surgery, you can do a couple of those little really gentle pelvic tilts in the bed within the first sort of 24 hours, but just really, really gentle. And then once you're home and you're starting to recover, you can get onto the floor and do them there, or if you can't get onto the floor, you can continue in your bed. And then you might start to aim towards doing 6 repetitions or 8 or 10, but just do them really slowly. Probably don't go beyond 12 repetitions. So let's now take our pelvic tilt and progress it. And we're going to progress into a bridge. So this would be definitely something you could do before surgery. And some of that after surgery you might want to attempt within about a week to 10 days. We're going to place our hands on the floor. And actually, if we've got anything under your head, you're going to pop it out. So we want our neck and head in alignment. And we want our arms nice and flat. Let everything relax. So we start with our breath, breathe in, ribs expand, exhale. We start with our little pelvic tilt and then we peel the spine off the floor, one vertebrae at a time, pressing up, hold at the top, take a breath in and then exhale and very slowly start to peel back down towards the floor. And rest and relax, let everything go. So this brings a coordination of the pelvic floor, the deep core, the glutes, the diaphragm, starts to pull it all together. It's a fabulous pelvic floor exercise. So we inhale, we exhale, we tilt the pelvis first, get that tuck, peel the spine away. Don't come too high, just the point that feels comfortable. Relax the neck, head and shoulders. Inhale and exhale. Like you're bringing the spine back down to the floor like a string of pearls and the pelvis untucks last. And again, exhale. Peel up. Now really start to think about drawing the pelvic floor up and in. Give these glutes a little squeeze, find the top of your bridge. Inhale and then exhale again to lower. The spine comes down. Keep the pelvis engaged. Release. And let it go. And again, exhale. So we might start off with just a couple of these bridges. And then as you start to get more confident and strong and you're feeling less vulnerable, you can progress to maybe 6, 8 or 10 repetitions. You can do this a couple of times a day. So I would start with your pelvic tilts first and then progress to bridge. But if you're pre-surgery, you can do all of this a good couple of times a day and maybe go up to 10 to 12 reps. So to now start to connect the pelvic floor a little bit more, we've got a Pilates ball. So you could use a yoga block or a folded hand towel or a little cushion. And you're going to place it between your knees. And the reason we do that is we bring awareness on the inner thigh, which connects to the pelvic floor, and it starts to really now pull everything together. So we're going to come back into our neutral position, but now we've got that little squeeze with that connection. And exactly the same thing. We're going to inhale We exhale, we tilt the pelvis, we bring the pelvic floor up, and you feel a lot more connection to the pelvic floor now. Lift into the bridge, hold, exhale, roll down. Same thing again. So this is a further progression, and you can just bring this in when you feel ready. Probably within a week to 10 days of surgery, certainly beforehand to prepare. When you come to the floor, completely relax, let it go and rest. Make sure your pelvic floor is really switched off, you're not holding tension. Always go through with 2 breath cycles. Breathe in, breathe out, peel up. You'll feel that connection to the pelvic floor. Glutes, push, hold, squeeze the ball. Bring a bit more awareness to the core and the glutes. Inhale. Keep it tight as you exhale and lower. Make it a little bit more intentional. Relax, let it go, let everything rest. Lovely. So that's just ways on how to progress through the breathing, finding the core, connecting the pelvic floor, pelvic tilts and into bridges, and then even a bridge with a ball or a connection. So let's come over onto our sides. We're going to roll over, again keeping our head low, protecting the abdominals and the pelvic floor. Then push up, and we're just going to come onto our hands and knees. And I'll show you something you can do on your hands and knees, which is another further progression to that bridge, to just really bring connection to the pelvic floor and the core. So come into a box position. And the first time you do this, it can feel quite vulnerable, but you just be sure that you're safe, you're not vulnerable, you are strong, and you're perfectly capable of getting into this position. And just sit there and see how that feels for a moment. Try to take tension out of your shoulders, but create a nice strong box. So we're going to start with just a really simple pelvic tilt, and it's really important that we just tuck the tail under. So we've got our hands under our shoulders, our knees are under our hips. We're going to push the floor away. We're going to inhale, and we're going to exhale, and we're just going to create a little tuck of the tail, like you're pulling your tail between your legs, and you're drawing your abdominals up through in the abdominals, just above your pubic bone. Relax that back down to a flat back, and again, exhale, get that little tuck, just the tail, and release it. So you can see how tiny this movement is. Tuck the tail, just working through that little pelvic tilt in this 4-point position. Keep the shoulders relaxed, working with the breath. Exhale. Good. So mistakes that people make here are that they try and make it too big. So they try and push the hips forwards. And actually what that does, it just creates more pressure through the abdomen, which you don't want. So it's very much like a little tuck and under. So imagine you've got a light on your pubic bone, and you're going to shine the light up the mat and onto the wall in front of you. So as we tuck, you get that kind of arc of light coming through. So we inhale, we exhale, we tuck, and it's just the pelvis. So that's all you're going to do for the moment, is just the pelvis. We're not going to come up into that big cat stretch just yet. And then one final progression, again, you can take your ball, your cushion, or your folded towel between your knees, and you can continue that same thing. So what we're doing now is just bringing a little bit more awareness to the pelvic floor. So we've got to squeeze between the knees, just gently. We exhale, we tuck, and release. And you'll feel that extra connection to the pelvic floor. Exhale. Good. So again, to begin with, just start with one or two repetitions, and then build up to a maximum of 10 to 12. And then take your ball out, and then take your knees apart, and then just very gently sit yourself into a modified child pose, and just allow your pelvic floor to relax, switch off, and then you can just rest in that position for a minute or two. So enjoy just experimenting with those movements and practicing those either pre-op or post-op, and just really learn how to coordinate the pelvic floor, the deep core and the diaphragm. Take your time, be kind to yourself, and just start enjoying putting that confidence back into your body. Thank you.